So what we see is that there are now over 281,500 people that have been vaccinated Australia-wide. In particular, you'll see that there are 58,358 people who have been vaccinated in aged care, if we can just turn to aged care. And of those, over 49,000 are first doses and over 9,000 are second doses. Very importantly, already 609 facilities have had first doses and 89 have had second doses. So good progress around the country with significant ramp up during the course of this week. If we then turn to the Phase 1B rollout, as we say, over 1,000 general practices are due to commence this week. I had the privilege of joining the National Health Co-op in Macquarie today, and to see Joe, our doctor, provide a very steady hand with vaccinating Lynn, our patient, and these vaccinations are occurring around the country today. We're seeing vaccinations in state clinics with regards to a focus on our health workers. We're seeing vaccinations in general practices, and we're seeing vaccinations in Commonwealth respiratory clinics. And I think that it's a signature day for Australia in terms of the vaccine rollout. And I want to thank our GPs. And what we've seen is that many of them are doing longer term bookings. The Prime Minister and I met with the general practices, with the heads of the RACGP and the Australian Medical Association and many of our rural bodies such as the Australian College of Rural and Remote Medicine and the Rural Doctors Association of Australia on Friday. And all practices are being given 12 weeks confidence with their minimum vaccine supplies, so they have that certainty, and they are free to book for long periods during that. The practice we visited this morning, for example, was making initial bookings right to the end of April, so over a 5-week period, and they're able then to book in many people and to give them that certainty. As well as that, the Commonwealth respiratory clinics are available. If I may, I might now turn to Brendan, and just to remind on the people who are eligible to be vaccinated, and after that he'll also address AstraZeneca and some great news, I think, on that front globally as well as domestically. Then we'll be happy to take questions.
Thank you, Minister. So just to remind people, those who are eligible to be vaccinated in Phase 1B, you'll recall that we've already started early parts of 1B with healthcare workers and household contacts of healthcare workers in some of the state-run clinics. But this is the really exciting thing, where we're rolling out 1B to the general population, initially to the over 70s and those with underlying medical condition, and Aboriginal and Torres Strait Islander people 55 years and over. As Minister Hunt said, there are 6 million people in Phase 1B. This is a huge and complex exercise as we roll out over 4,000 points of presence over the next month. Getting vaccines to all of these points of presence is a complicated and sophisticated logistic task, and of course as new clinics come on board, more appointments will be available and more access will be available. So we do say, as I've said on many occasions, we are rolling out clinics, points of presence and vaccine as soon as we have available vaccine, and I'll come to that in a minute. But that is the major determining factor of the rate of rollout. So we do ask people, I know there's a lot of enthusiasm, which is great in Australia, to get vaccinated, but be patient and wait, look at the eligibility checker and wait for appointments to come up. So the particular focus obviously at the moment is on the over 70s and 80s and those with chronic conditions, the more vulnerable population, and we have deliberately sought to vaccinate those people mainly in general practices, because general practices are the place where they are known, they know what their conditions are, and they feel comfortable in that setting. So it is going to be a big exercise, and we're so grateful to those wonderful general practitioners around Australia who have put up their hand to be part of this vaccination program and have started already. Next slide. The AstraZeneca vaccine is our workhorse vaccine. I have said on many, many occasions how lucky we are to have onshore production of a vaccine. Every country in the world that is dependent on international supplies is facing supply chain challenges. This workhorse vaccine is being produced in Australia, and very excitingly, the TGA only yesterday approved the local production of this vaccine. The vaccine that has been cross-licensed from AstraZeneca to CSL and is being made in Parkville, and increasing doses will be coming off the production line over coming weeks in Parkville. That will provide us with a reliable, steady and progressively increasing source of vaccines so that we can expand our rollout.